Hello, I'm Ken Anger. I and two colleagues, Jen Dimoff and Lindsay have conducted a systematic review of evidence-based interventions of mental health in healthcare workers. The findings and conclusions of the presentation are our own, not necessarily the funding agency, and I do declare a financial interest, which is managed by my university. Scope of our systematic review was to provide a comprehensive assessment of proven interventions available for the prevention of adverse mental health outcomes in healthcare workers. Our target audience was people who run healthcare systems. Our search sources included Medline, Psych Info, and 9 more. The study's inclusion criteria were that they recruited healthcare workers, included one or more mental health-related outcomes, and most included more than one, and evaluated an intervention of some form. We started out with a little over 5,000 publications and ended up with 118 interventions that met inclusion criteria. They were conducted in 25 different studies, really from every continent, but the largest number of them by far were from the United States. Each article underwent a quality rating by at least 2 authors, and they ended up with ratings of 20 to 22, which we considered excellent in 20 of the articles, but 48 of the articles ended up with satisfactory ratings, in our view, of 15 to 19. Most of the designs were randomized controlled trials, although there were almost as many quasi-experimental trials, and we consider those to be satisfactory. The number of people in the studies ranged from 11 to 1,575. There were 11 to 50 people in 46 of the studies, indicating there were a number of small N studies, but there are also studies with 250 or more people in them. The predominant occupation of the people in the study were nurses. There were 78 studies that had nurses, but many of them had physicians and other job titles as well. How did they measure the change? Well, the majority of the studies started at baseline and had measurements then at 3 or 6 months follow-up to see what the impact was of the intervention. The intervention types we categorized into these different categories: coping skills development and mindfulness being the most frequent. Health literacy and anti-stigma, reflection and relaxation, however, had a significant number of studies. But if you look down to organizational and system level, there were only 11 of the 118, indicating that not many of the studies focused on fixing the organizations or improving the environment of the organizations, but more attempted to improve the individuals once they had mental health problems. We found 44 outcomes in those various studies, those 118 studies, and we categorized them into these different categories, and the outcomes were measured by standardized surveys widely used in the field. Were the interventions effective? Well, the answer is yes. If you look at the top row, there were 29 interventions that improved stress with large, medium, and small effect sizes among those. Among the most highly rated studies, coping skills development and mindfulness interventions had the most studies. There were 26 of those. How long did they take? What will they cost an organization, the hours per participant taking the intervention? 55 interventions required 10 or fewer hours of participation time per participant. Are they available? Almost 1/3, 37 of 118, of the intervention protocols and methods are available from the intervention authors or described in sufficient detail to enable implementation, in my view. Here is the reference to the article in the American Journal of Public Health. And once you've seen that and looked at the supplementary tables, you'll also find our intervention selection website will be useful to help you winnow down the ones that are important. Thank you.